Spanish edition of Family Health. Every Thursday we discuss health. Today we are going to be looking at brain tumor. What are the causes of brain tumor? What are the symptoms, and how can we manage as well as prevent brain tumor? That's our topic of discussion today. Plus, in the program we are going to have our advertorial, the mutual assistance and solidarity Damaso. We are going to have our loan slot in the program, the discovery page done for us by Glory Ngange, and of course beautiful music to entertain you this afternoon. But before we kick started, we have a technical team assisting us this afternoon. It is made up of Ulrich Kamui, our sound engineer, and our studios clerk. Our video editor for our YouTube channel is Brian Bida. For editorial coaching is Abel Bilasamari, coordination Roger Kiek, and for general supervision the Reverend Pastor Bisai Emmanuel Noel. For presentation, my name is Frinwe Crispin. We are going to be together from now to 1:30 p.m. in the program Family Health. We kickstart with the gospel music.
Hallelujah. You are who you are. Yesterday, today, and forevermore. What you say is what you do. You never fail, you never change. You are faithful till the end. Faithful God, I worship you. Too faithful to fail me. You're too faithful to that you're too loving to leave me. Lord, you're too loving to leave me. You're too loving to leave me. Too loving, too loving, too loving. You're too loving to leave me. Too loving to leave me. Lord, you thought you always been. I've come to realize. Lord, you loving to leave me. Yes, you're too faithful to fail me. Lord, you're faithful to fail me. You are Lord. You are Lord. You are Lord. Lord, you're faithful to disappoint me. Oh Jesus, you've proven yourself. Proven yourself in my life. I've come to realize. Lord, you're faithful to fail me. You are too committed to leave me. Oh Jesus, you are too consistent to leave me halfway. What you start, you always finish. Lord, I've come to realize that you are too faithful to fail me. What you start, you always finish. Lord, I'm here to testify. You're too faithful to fail me.
Thank you so much, Ulrich Kamui, for that beautiful gospel music. It is always a pleasure to praise God, to give Him all the glory, all the honor, because He deserves it, because He is the owner of our life. He is our maker, He is our protector, He is our director. Let's move now into the mutual assistance and solidarity, our advertorial. Dear listeners, if you're just joining us this afternoon, you are on to Family Health on Royal FM 88.4, and right now we are discussing the mutual assistance and solidarity. In the mutual assistance and solidarity, we begin by reminding our mutualists who are ready for the raffle draw ceremony come July the 4th, 2026, that we are left just with 2 days, let's say less than 2 days, to take part in that ceremony. It's going to be taking place at the Amadou Ahijo Stadium here in Yaoundé, and trust me, it's going to be grandiose, it's going to be big, and it's going to assemble so many people, so many mutualists. It's going to assemble so many Africans, of course, because we have foreigners who have registered, and it is linked to the spirit of solidarity, bringing Africans together, bringing Africans to work together, bringing Africans to support each other. That is the vision of the mutual assistance and solidarity, the MASO. And today we are just reminding you that, telling you that we are left just with 2 days to take part in that event, which is going to be at the Omi Sports Stadium. And as you know, we ended with registrations and contributions already, and what mutualists are currently doing is going to withdraw their raffle draw ticket at Auburn Pro Finance SA branches in Yaoundé and in Cameroon. They are available for you to go and withdraw, because this ticket is what you are going to be using as a mutualist on Saturday to drop it in the different raffle draw boxes. Yes, and it is noting that on that day, that is Saturday, July the 4th, 2026, mutualists are called upon to be at the Omnisport Stadium as from 7 a.m. That is for you to be able to drop your raffle draw ticket in the different raffle draw boxes. Yes, at that time we are calling on all mutualists, wherever you are in this Yaoundé, please take the rendezvous 7 a.m. on Saturday, July 4, 2026, to drop your raffle draw ticket into the raffle draw boxes that are going to be put at your disposal there at the Omnisport Stadium in Yaoundé. We will have people who are going to orientate you on how to do it. Everything is well planned, and the ceremony is just left to kickstart. Everything is set, and we are calling on everybody to withdraw their raffle draw ticket in Auburn Pro Finance SA branches, because there is no time. You're left just with 2 days to do that and take part in that raffle draw ceremony that is coming up on Saturday. Now we move over to other things, to tell you that on that day you will be privileged to back home so many offers that you maybe have subscribed to, depending on what you wanted, depending on what you desire. Is it financial assistance? Is it vehicles? Is it taxi? Is it motorbikes? Is it tricycle? Is it a house? Is it, whatever you wanted, they will be given to you, and you will choose what you want, what you desire. And on that day, the hand of God, the work of God is going to manifest in your life, and who knows, you shall be raffled out. You shall be among the lucky beneficiaries of the mutual assistance and solidarity, and in one way or the other, it's going to greatly assist you. It's going to greatly help you and help your family member. From there, now we move over to tell you some of the advantages that you can have from the mutual assistance and solidarity, aside from the raffle draw ceremony that is coming up. Yes, aside from that raffle draw, we have other things that you can benefit from the mutual assistance and solidarity. It is worth noting that we are getting set for the Maso Act 6 raffle draw on Saturday. We are already at Act 6. Can you imagine? Act 6 already. We started at Act 1, and like a joke, we are already at Act 6. And you that have been hesitating since the first act, do you realize you're already 5-6 years into this issue and you're still hesitating? You don't want to register, you're like, oh, I don't believe. What don't you believe? It is a reality. It is happening. People are winning, people are coming out victorious, and you're still hesitating. Anyways, we don't have all hopes lost, because we have Act 7 that is also going to be coming up, and it is possible for you to register. Aside from the raffle draw ceremony, aside from the different prizes that you're going to be backing home on that day, we have several advantages that you can benefit from the mutual assistance and solidarity. First, we begin with health advantage that you can have, health things that you can have from the mutual assistance and solidarity. We have a Mami Hospital complex here in Yaoundé where you can go to as a mutualist, because it has been constructed for that purpose. If you're a mutualist, registered mutualist with up-to-date information, you can benefit from a 35% discount on hospital fees. All the bills that you will be paying in the hospital, you will have a discount of 35%. That is your total bill. You have a discount, not your total bill, each thing that you're going to be paying, each bill that you're going to be paying, you have a discount of 35%, and that goes to up to 10 persons behind you. We could say 10 family members consisting of your friends, whatsoever you wish to add. 10 people behind you can benefit from this 35% reduction. That is one of the things that you benefit when you're a mutualist, aside from the raffle draw. And we move order to something else. We have legal assistance. If you are a mutualist, up to date with your contributions and up to date with everything, you can benefit legal assistance, and it could help in the drafting of contract, legal and judicial guidance, and support in case of litigation within the scope of professional activities. If you have a court case and you need help on how to go about it, the Mutual Assistance and Solidarity will provide someone that is going to help you, that is going to guide you on what decision to take, help you draft contracts and everything concerning your case. That is just another advantage of the Mutual Assistance and Solidarity, because you are a mutualist. Now we move to one last advantage, but that's not the least. We have so many advantages, but we move to this one where we have the free installation of boreholes in neighborhoods. Yes, the Mutual Assistance and Solidarity, the MASO, one of its vision is to assist the government fight the issue of water shortage in Cameroon and in Yaoundé precisely. And for that, the Mutual Assistance and Solidarity helps neighborhoods, communities, villages with the construction of a borehole, installation of a borehole in their neighborhood, in their village. And this is to enable them have potable water, have good water at their disposal. And this is done when at least 20 mutualists are of that neighborhood and up to date with everything that concerns the Mutual Assistance and Solidarity. So if you are in a neighborhood where you guys have water issues and you desire that the Mutual Assistance and Solidarity assist your neighborhood with a borehole, all you will need to do is make sure that in that neighborhood you guys are at least 20 of you into the Mutual Assistance and Solidarity. From there now, you can write a request precising where you want your neighborhood, where you want the borehole to be installed, and every other details, and drop it at any Renapro Finance SA, and then your request is going to be validated if all requirements are met. So that's it for some of the advantages that you can have in the Mutual Assistance and Solidarity. We come back with our MASO Act 6 raffle draw ceremony coming up on July the 4th, 2026. That everything is set, all is ready. Mutualists are awaited as from 7 o'clock in the morning on Saturday, 7 a.m. on Saturday. Mutualists, we are expecting you at the Amadou Ahidjo Stadium with your different raffle draw tickets to come take part in the ceremony, to come drop your raffle draw ticket, as well as take part in the ceremony as from 12:30 when the raffle draw ceremony will start. And that day, dear mutualists, you will not feel bored, because everything is going to be lively, everything is going to go on smoothly, and it's going to make you enjoy that day. Enjoy it with your neighbor, with your friends, with your fellow mutualists. You guys together are going to be celebrating the spirit of African solidarity in the Mutual Assistance and Solidarity, that is MASO Act 6.
The time is 1 p.m.
Do you know about Beam? The offer that enables you to call all networks at the same price and enjoy TikTok and Snapchat data bonuses. Activate now on #200#.
Renapro offers MASO.
I see joy, I see tears of joy, and I see how somebody has suffered.
As I've won today, I really appreciate this offer.
I want to thank MASO for that, because at the onset I was really skeptical about it, and I was scared. I was just saying that this is all fake, but today is a confirmation that it is not a fake news, it is actually right, because I just had the opportunity of winning the sum of 1 million francs.
I just won 750,000.
Act 6 have already started. I will register for Act 6. I subscribe for the villa.
And what if your solution comes from MASO Act 6? Rush to any Renapro Finance SA agency and MASO registration points for your registration and contribution. Grab the opportunities offered by the July 4, 2026 event, which starts from 7 a.m. at the Amadou Ahidjo Stadium in Yaoundé, and be one of the lucky winners of the different offers. At MASO, we simply live our African values. Renapro of MASO.
Je suis enseignante de formation, mais j'opère beaucoup plus dans la fossiculture. Je suis vraiment comblée parce que ce chèque arrive à pic, parce que j'étais vraiment dans le besoin.
Contente. Merci beaucoup au Seigneur parce que grâce à lui, j'ai eu ça.
Je suis tolé de profession et commerçant. C'était vraiment un rêve pour moi, je ne m'y attendais pas.
Je suis vraiment très content de Renaprov parce que ce financement va me permettre de réaliser mon projet d'élevage de poulets et de porcs.
Et si ta solution venait de Masso, Acte 6, rapproche-toi de nos différentes agences et points de souscription Masso pour souscription et cotisation et saisis cette opportunité le 4 juillet 2026 dès 7h au stade Omnisport à Madou Aïdjo de Yaoundé et tu seras certainement l'heureux bénéficiaire de l'une des offres. À la Masso, vivons simplement nos valeurs africaines.
Tombola Masso Acte 6, c'est la fête. Rendez-vous le 4 juillet 2026 au stade Omnisport de Yaoundé pour un événement exceptionnel. Au programme, un show inédit et des prestations exceptionnelles avec Isawan,
beaucoup s'amuser.
Junior Bellinga.
Venez massivement, on va s'envoler et le nom du Seigneur sera glorifié.
Et surtout, John Duchamp.
Le show sera de taille. Avec la Masso, je serai là.
Des surprises et une ambiance unique vous attendent. Notez bien, entrée gratuite. Venez nombreux et ensemble célébrons les valeurs africaines. Tombola Masso Acte 6. Plus qu'un événement, une célébration.
Health is wealth. You want to learn about health? Family Health is here for you. Family Health is a 90-minute program that looks into the psychosocial and clinical aspects of the society.
With our resource persons, we discuss health issues in down-to-earth terms.
Join us every Thursday from 12:30 p.m. to 1:55 p.m. on 88.4 Royal FM, the Listeners Radio, and live on Facebook at Royal FM Cameroon.
Family Health.
Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease for infirmity.
If you are just joining us this afternoon, you're on to Family Health, and on Family Health this afternoon we are discussing brain tumor. And if you wish to join us this afternoon to give your contributions concerning our topic of discussion, you can do so through our line 67115 7321 67115 7321 or 640 61 3842 640 61 3842. We are waiting for your diverse reactions concerning our topic of discussion, brain tumor, and we will move directly with our guest. Her name is Mundi Noela. We had a chat concerning brain tumor. She told us a whole lot of things concerning this, our topic of discussion. Please pay attention to our chat. Good afternoon, Dr. Mundi Noela. You are welcome to our health program, Family Health, on Royal FM 88.4.
Greetings to everyone, and thank you for the opportunity to be part of your program.
Doctor, today we are talking about brain tumor. Doctor, please, can you begin by telling us what brain tumor is?
So a brain tumor is a mass of cell which is located in or around the brain. It is caused by an abnormal, excessive and random division of cells that are normally supposed to divide and replace other cells that have become worn out in the body or in the brain. So in our body we have cells that constantly divide to replace other cells that have become worn out or cells that are dead. When these actively dividing cells become exposed to certain conditions, which we call risk factor, the division can become abnormal, leading to the formation of cancerous or tumor cells, which can accumulate either within the brain, if the cells that were dividing are located in the brain, or elsewhere in the body. So you can have cells that are actively dividing elsewhere in the body, which become cancerous and give rise to this mass of cells that can leave that area of the body and travel to the brain. For example, breast cancer. Breast cancer can leave the breast and get to the brain. So we have what we call primary brain tumors. That is tumors that are originating from the brain itself. And we have secondary brain tumors. That is tumors that originate from other organs in the body and they travel to the brain.
How do the symptoms of brain tumor manifest?
The manifestation or symptoms of brain tumor will usually depend on the size and the location of the tumor. We know that the brain controls so many functions in the body. For example, we have an area of the brain that controls muscle contraction and movement. If a tumor is located in such an area, it is going to compress that area and patients might not be able to move certain parts of their body. They might become paralyzed in certain part of their body because that area of the brain is being compressed or has been affected by a growing tumor. If the tumor is located in other areas that are responsible for behavior, speech, sensation or feeling, patients might have difficulties speaking or understanding language. They might also start behaving abnormally. You might see a patient who was usually very calm, quiet, and suddenly they become very aggressive. They don't have emotional control. They speak rudely to people. There is this behavioral abnormality because the brain tumor is compressing that area of the brain. Patients can also present with headaches. Headaches are one of the most common manifestations of brain tumor. These headaches are usually resistant to painkillers. So patients might have headache, they take the best painkillers, but yet they don't have any relief. Patients can also present with convulsions. You see an adult who suddenly starts convulsing, even a child who suddenly starts convulsing, especially if the convulsion is limited to one side of the body, it could be a sign of brain tumor. So patients who have brain tumors that originate from other areas of the body can present with symptoms that are specific to those areas of the body. For example, if it's a brain tumor that originates from the breast, the woman might present with signs of breast cancer, tenderness, changes in the aspect or the physical appearance of the breast, abnormal secretion from the breast, or patients might even present with severe weight loss. They might have anorexia, they don't have appetite, they might have continuous fever, weakness, or fatigue. So the symptoms of brain tumor will usually depend on the size and the location of the brain tumor.
What can be the possible causes of brain tumor?
There are so many causes of brain tumor, but the most common ones are being exposed to radiation. For example, radiation that comes from certain investigations that we do in the hospital. If patients become frequently exposed to those investigations, they can subsequently develop brain cancer. I'm not saying that these investigations cause brain cancer. They only cause brain cancer when they become when patients are exposed to them frequently. For example, genetic abnormality, or you have that genetic abnormality. You can also have genetic abnormality, or you have that genetic abnormality. You can also have brain tumor because, like I said, you have a tumor elsewhere. So if a woman has, for example, breast cancer, or a man has prostate cancer, those are cancers that can travel to the brain and cause brain cancer. So other forms of cancer are a risk factor for brain tumors. And
Doctor, tell us, can the condition affect anybody of any age?
Brain cancers can affect anybody. A child, an adult, an elderly person can develop a brain cancer. It depends on their risk factor, and it's even possible to develop a brain cancer when you don't have a risk factor. A risk factor simply increases your risk of developing a brain cancer. It doesn't mean that if you don't have a risk factor, you cannot develop a brain cancer. So it's possible to even develop a brain cancer or a brain tumor when you don't have any of the risk factors that I've mentioned. And I even forgot to mention, there are certain types of infection. For example, HIV infection. HIV infections can weaken your immune system. predisposing you to developing a brain cancer. So anybody at any age, of any race or sex, can develop a brain cancer.
What is the rate of prevalence worldwide?
It is estimated that about 300,000 cases of brain cancers or tumors are diagnosed yearly around the world. The statistics in Africa are not very clear because there are very few studies that have been done to determine the prevalence of brain tumors and cancers in Africa. However, based on the available evidence, it is estimated that the prevalence of cancer, of brain cancers or tumor in Africa is lower compared to other regions like North America, European countries. In Cameroon, fewer studies have been done to estimate the prevalence of brain cancers or tumors in different regions of the country. But there is a common finding that patients who have brain cancers usually present very late. So we raise awareness so that people can present early, because the earlier someone presents to the hospital, the better the results of treatment.
With all you've said, doctor, how can this condition be diagnosed and how can it be managed?
Brain cancers or tumors are usually diagnosed with different investigations. So when we see a patient in whom we are suspecting a brain tumor, there are a series of investigations that we do, including brain imaging, which is the most important investigation that we do to diagnose brain cancer. You also have to do certain genetic tests. If you're suspecting that there's a genetic mutation that has led to this brain tumor, you need to do a genetic test. You also need to do other blood investigations, which are like I said before, you can do blood workup to see if this patient has maybe a blood cancer which has traveled to the brain, or you need to do, if it's a woman that is coming and the woman is presenting also with signs of breast cancer, you need to do other investigations to confirm the diagnosis of breast cancer. If it's a man, maybe a man in his 40s or 60s, you need to do investigations to ensure that this patient does not have a prostate cancer which has traveled to the brain. So there are different ways of managing breast cancer, and the management will usually depend on the type of the brain tumor and the location as well as the size. So the main ways by which we treat brain tumors include radiotherapy. So I mentioned before that being exposed to radiation can increase your risk of having a brain tumor. But yes, we still use radiation to treat those cancers. So radiation is one of the common ways by which we treat brain tumors. And we also have chemotherapy. So chemotherapy is actually using medications like drugs to treat the cancer, to kill those cancer cells. And you can also have what we call surgery. Surgery is usually used when the brain tumor is very localized and it's small in size. So these are the main ways by which we treat brain cancer. We can either use only one of these methods, or we use them in combination. For example, sometimes we can start with chemotherapy, then we move to radiotherapy, or we can start with radiotherapy and then we use surgical management. We operate and then we remove the tumor if it's very small. So,
doctor, can brain tumor be life-threatening, and can someone live a normal life after brain tumor?
Brain cancer is a life-threatening condition if it's managed late. Unfortunately, in our context, late presentation is a problem. Many people present late because when they start having symptoms like headaches, convulsion, or weakness, they will try to take traditional medication. They will try to buy medications from stores. They take over-the-counter medication. It's only when they don't have any other solution that they are going to opt for medical treatment, which is very poor. Because with brain cancer, as time goes on, the cells remember that the cells are multiplying randomly and rapidly. So the more you waste time, the more the cancer is going to grow. And quite often when patients present, they always present at a stage where there is very little you can do. We only do what we call palliative care. So we help to alleviate the pain. We help to support the patient so that the patient can have, in quote, a peaceful death. So we are encouraging people to present early. When you start having headaches, frequent headaches, when you start having seizures out of a sudden, please go to the hospital. It could be a sign of a brain tumor. If you are having changes in your breast, if you are a woman, or you start noticing certain changes as a man, you have problems with urination, you have to force urine before it comes out. When you want to urinate, you're feeling pain. Even after urinating, it's like you've not emptied your bladder. Those are signs of prostate problem. And prostate problem could be a sign that you have a prostate cancer. And like I said, prostate cancers love the brain, so they usually leave the prostate. Part of the cancer can leave the prostate and it gets to the brain where it's going to cause brain tumor. So brain tumors can be a life-threatening condition, especially if they are not treated early. Patients can live a normal life if they go early to the hospital. There are treatments that can help to shrink the tumor. So there are treatments available in the hospital that can help to even cure a person of brain tumor. But this treatment work best when patients present early in the hospital at the early stage. So when the tumor is very small, they can easily be removed through surgical management, and they can easily be cured with medication when they are very small. But once the tumor has grown to the point where it is compressing structures, the prognosis is very poor. The outcome is usually very poor. The death rate is very high when the patient presents at a late stage where the tumor has grown so big that it is compressing surrounding structures and causing difficulties with consciousness, difficulties with certain functions like breathing. So we always encourage patients to present early. As soon as you start experiencing frequent headaches that are not responding to painkiller, or you have changes in your headache, maybe you've been having headaches before, but there is a sudden change in that pattern, or you start experiencing seizures out of nowhere, you see this person who was behaving normally, suddenly they start having abnormal behavior. These are all signs that the person could be having a brain tumor.
Let's move over to the prevention, doctor. How can this condition be prevented?
How can we prevent brain tumor? We should avoid excessive exposure to radiation. So as clinicians, we are always advised that we shouldn't expose patients to unnecessary radiation. Make sure that the investigation that you are prescribing to a patient is absolutely necessary, especially those investigations that expose patients to radiation. So make sure that it is absolutely necessary. Also, we advise, sometimes you might not be able to prevent the tumor, especially if it's a genetic abnormality or mutation. There is no way you can prevent it, but preventing yourself from being exposed to certain things, for example like radiation, can significantly reduce your risk of developing cancer. And if you have other types of cancer, for example prostate cancer, breast cancer, it is highly advisable to go to a hospital for treatment early, because if you don't treat it early, then it is going to spread from maybe the prostate or the breast to the brain. So these are good ways by which you can prevent brain tumor.
Thank you so much, Dr. Mundi Nwela, for responding to questions on family health. And that was our little discussion on brain tumor with Dr. Mundi Nwela. Now we are going to take our long slot in the program, the Discovery page.
Family Health, our discovery, our discovery.
And for our Discovery page, we have Glory Gange with us. Glory Gange, good afternoon.
Hello, Finyo Crispin. Good afternoon, listeners. Have you heard of thigh chafing before? Chafing generally is an irritation of the skin by repetitive friction, usually from the skin rubbing against skin or clothing rubbing against the body. When this happens, you may start feeling a stinging, burning rash that is often red and raw. It is most common on the inner thighs, groins, armpits, and under the breast, but for most people, it happens on the inner thigh. Today's discovery will focus on the inner thigh friction and how it can be managed naturally. This particular chafing occurs when inner thighs rub against each other or clothing, creating friction and worsened by sweat and heat. Apart from humidity and heat, some other things that can cause blisters on your inner thighs are walking or running, wearing thin leggings, skirts or shorts that don't provide enough barrier between your thighs, wearing cotton or other fabrics that don't absorb enough moisture. There is also trapped moisture between skin folds. Additionally, excess weight in the thighs, arms, or abdomen can increase the risk of skin rubbing against itself and causing irritation. For other parts of the body, friction can occur during breastfeeding. Nursing moms often experience skin chafing due to moisture on the nipple added by wearing a nursing bra. First treatment is gently washing the red spots with clean lukewarm water and dry by patting with a soft clean cloth. And then aloe vera. This is a succulent that has a long history of being used for medical purposes. The clear gel that is found inside its leaves has been used for centuries to soothe and treat burned skin and other surface wounds. It may also help reduce the irritation and inflammation caused by chafing. Coconut oil as well is a universal healing liquid as it reduces inflammation, help with wound healing, and kill off bacteria on the skin. Another natural solution is cornstarch. Cornstarch has the ability to absorb extra moisture from the skin and to reduce itching. It can also create a silky feeling on the skin that may help prevent further friction and irritation. Apart from the above treatments, you can also go for shea butter or petroleum jelly. They help reduce further chafing because they provide a slippery surface and isn't quickly absorbed into the skin. Other options include applying balms, putting on protective shorts, and nipple covers for breastfeeding moms. Remember, these natural tips should always be adopted in situations where the irritation is moderate. But if your skin has blisters or open sores, it is better to avoid powders or lotions until the skin has healed to form a protective barrier, or better still, see a medical expert. And it's a wrap on today's discovery. Fenyo Crispin, thank you for having us.
Yahweh, oh, si je te laisse, à qui irai-je? Yahweh, oh.
Thank you, Glory Ngange, for that interesting discovery page. Hope that next week we will be together to discover something very interesting on our discovery page, as well as discuss something interesting in family health next week. And beautiful people, we thank you for being with us on today's edition. It was a pleasure to always have you, hoping that next week we are going to be together by God's grace. Ulrich Kamwe was our sound engineer, and our studios clerk Brian Bida was our video editor. Editorial coach Enable Bila Samari, coordination Roger Kiek, and for general supervision the Reverend Pastor Bisai Emmanuel Noel. For presentation I have been Frimie Crispin, and programs continue on Royal FM, but first the 2 p.m. newscast is coming up this afternoon. Tomorrow you will have Raisa Parker on Fraîcheur Royal Santé. Other programs continue, and up next is Dieu et Société, a presentation of Theophile Awana, who will be joining me in the studio, or will be coming to the studio in some minutes to come. Have a blessed Thursday and a happy weekend in advance.
Even when my world is bleeding, I keep moving.